very brief numbers that we have and how that has been updated. If you look at June the 26th, we had 16 people in the hospital total, 13 on the floor and 3 in the ICU. Today we have 62. There are 39 people in non-ICU acute care beds, and there are 23 people in the ICU. One thing that's striking about that Dr. Lancaster, one of our physicians in charge of informatics, pointed out to me a few days ago that was a bit startling is that at the height of the pandemic, 52% of our intensive care unit beds were taken up with COVID cases. Right now, it's in the 30% range already. And that was the 52% represented when we had 170 plus people in the hospital. So with 62 people in the hospital, it is 60% plus of what we had at the peak of the pandemic. So I have been relatively confident, and still I'm very hopeful, that we're not going to see the sorts of numbers in the hospital that we saw at the worst of this. But we certainly are on a trajectory that is very problematic. It's I think Rochelle Walensky is expected to make some comments in an hour or two about some of the changes, obviously, in mask utilization by the CDC, et cetera. So happy to answer any questions that anyone has.
Dr. Threlkeld.
Hi, Jane.
Can you tell us, really, when the CDC released its previous guidance, the Delta variant wasn't so full-blown. Now it is, and that seems to be the X factor. Do you want to say a sentence or two about what Delta is presenting us with now?
Yeah, I think that's very much the case. I mean, the CDC, I think it's people act like, and you'll see reports that it's a problem that the CDC is changing their guidance. The problem would be is if they didn't change their guidance. You have heard from people on the front lines, me included, over the last couple of weeks, things that are now being more officially recognized in the change of advice by the CDC. We've known that numbers were going up fairly dramatically. We have known that this is a much more contagious virus. It is, in fact, as you point out, a very different beast that we are facing now from what we faced before. And that filters down to all aspects of our response to this. The schools that we saw, the studies in schools showed that in-person learning was very safe. That presupposed non-Delta virus. It presupposed mask utilization. It presupposed adequate distancing in those studies. So we can replicate 2 of those things, but the Delta virus is a different army that we're battling. So it changes all of these things. And it's not a surprise that it takes a little while for what we see firsthand on the ground to be examined, the data collated, considered, and then that to translate into more official guidance by the CDC. And that's, in fact, I think what you're going to see this afternoon. They're going to recognize the fact officially that this is a much more contagious virus, and it is striking us hard in areas of the country that are unvaccinated. And so I think you'll see something of a regional advisory about this. I talked to a good friend in Boston this morning, and she, upon doing a week or so in the infectious disease service, saw only a couple of people with COVID in their hospital who were ill. And so that's a tremendously different experience from what we are having here. It is not because people in the Northeast are of hardier stock. It is purely and simply because they have been vaccinated at much larger numbers than we are. So the Delta variant is the entire difference. We have from the beginning, I think, expressed the concern that we would have variants downstream somewhere that would be more difficult to fight. They might be much more contagious, which really has been the crux of what we've seen. They might be more virulent. We really haven't seen that much more deadly virus at this point. There might be all sorts of problems that mutants downstream could cause us. And this is nothing more than that coming to fruition. And it causes some significant new problems, and not to mention the fact it's not just that the elderly have been vaccinated in large numbers. That's a great thing. The folks in nursing homes who really made up a huge percentage of deaths from this infection early on, they're now relatively protected. How protected they are will remain to be seen because I think this virus is so much more contagious that it is hunting you if you are not vaccinated, purely and simply. And we've said for a while now, the odds of you getting out of this without getting either COVID-19 or a vaccination would be decreasing greatly with every passing week. And so we certainly have seen breakthroughs, more so with the Delta than anything that we have seen in all the time before this. But make no mistake, almost everyone who is a breakthrough is a mild infection. I've seen any number of people, including healthcare workers, who have become infected. They are either asymptomatic or they are minimally symptomatic in almost every one of them. Almost every case we see in the ICU now is someone who has been unvaccinated, and they are younger. We've had several people in the ICU in their 20s, their 30s. We lost a patient in their 40s over the weekend, and in their 50s. So really, it's an entirely different picture that we are fighting than what we were fighting before.
Thank you.
You bet.
Dr. Threlkeld?
Yes.
Janae Lewis with Channel 3.
Hi.
You're talking about this particular variant striking us hard. How does that change the strategy and the approach here, specifically in the Mid-South?
Well, I think that, and you'll see, I think that represented in Dr. Walensky's remarks in a little while this afternoon. I think there are basically, there are several things that you can do to fight this infection. They are, by far the most important would be vaccination. The vaccination is highly effective and it is highly safe. And I'm actually relieved to see some of these tragic cases being translated into, I think, where people are actually giving testimonials. You'll see not just people who have had this infection and are saying, I didn't believe this was a big deal, but I've learned otherwise, and I would urge people to go out and get the vaccines. And even worse, you'll see parents who say that I have lost children as a result of this. There's a case that's made a fair amount of national news of a lady who lost her 28-year-old son. And she said, we thought it came on too fast. We thought it needed more time. We thought it was overblown and political. And I'm very sorry that we thought that, because I've been through a terrible illness and I've lost my son. And his last words were, Mom, this is not a hoax. This is real. And we have all seen this. I've seen several people who could not breathe and have been put on the ventilator because of COVID-19. And almost to a person, they say, I didn't get the vaccine, but I want it now. Well, it's too late. In fact, it takes 5 weeks from the time you decide to protect yourself, with the RNA vaccine at least, to get that protection. So I think getting the vaccine is far and away the most important issue for us. If you have never been unable to breathe, it is drowning above the waterline. And if you have that happen to you, I can assure you it will change the way you look at life in a number of ways. And there are very few people who've been through this illness who don't want the vaccine now. And unfortunately, we've seen a lot of people happen to this who've said it won't or can't happen to me, and it simply can. Beyond the vaccine, of course, is what we're going to hear about probably this afternoon from the CDC. Masking of people who could be the source and who could be the recipient of that infectious interaction remains important. That and social distancing. I mentioned in school some of the studies were done with adequate distancing, with masks, and prior to the Delta variant. With the Delta variant here, it is much more contagious. It jumps farther and higher than the virus did before. So our behaviors really are going to be more important right now. And so I think the CDC guidance will be in those areas where there is low vaccination percentage, that we need to go back to some of those behaviors, such as masking, even in the unvaccinated people. Now, why unvaccinated people? Why bother to get the vaccine if you're going to have to wear a mask anyway? And I think the idea is simple. Though the vast majority of cases are coming from, and of course coming to, unvaccinated people, it is more and more clear, and we've seen this on the ground. I mean, I've seen any number of vaccinated people get minor to really no illness, some asymptomatic, some mildly symptomatic. But the reality is that the data are starting to accumulate for the CDC that those people can, in fact, be the source of infection to other people who may have chosen not to be vaccinated, which is all too high a percentage, other people who may be immunosuppressed and not get an adequate response to the vaccine, other people like elderly individuals who may have a waning of that immunity faster than others. We don't have a great handle on that issue, but it makes sense that that could happen. So I think that what you're going to see is guidance indoors to wear a mask like we did before. And this is, I mean, look, I've been critical at moments over the course of this pandemic of how the CDC has messaged things, but I don't think this is one of those times at all, that they are recognizing that this is a different battle that we are fighting, and they are adjusting our way of doing it. And there's no question that this is a more difficult situation that is, I mean, as I say, we have doubled our hospitalization rate almost in the last week. We've tripled it in a month. And again, I'm hopeful and confident that we will never get to where we were before. We're certainly pointing in that direction a lot more steeply than I would have been comfortable. I would not have expected these numbers this quickly. So I think what we do is we vaccinate ourselves as quickly as we can to get that immunity. And I think we have to realize that this is a very contagious virus. I have seen people get it who have been masked. The problem is that they are around people who are not masked, who are putting out virus toward them in a much higher number and in a much more contagious virus that makes them more at risk. So what the CDC has set up to now is that if you're vaccinated, you don't have to wear the mask indoors, but if you're unvaccinated, you should. Now, we're all practical people, and everyone would have to agree it's very difficult to tell who's vaccinated and who is not. And the simple reality is that the unvaccinated people are not wearing the masks. So, it's very difficult to impossible to have a mask recommendation for only those who are unvaccinated. I think if you're serious about it, then practically speaking, you have to mask everyone or just not worry about it at all. And unfortunately, in several areas of the U.S., of which we are very much included right now, is that we need to be careful, and that the people who are unvaccinated particularly are at risk, and those even who are vaccinated may be able to transmit this in some numbers to folks who are not. So I think it makes sense. The distancing goes along with the masking. I think we're basically taking a step back based on the data, and those data are somewhat alarming. I think that, I think those of us in healthcare are very frustrated right now. I think if you look back, these testimonials that I mentioned are effective because it allows people to understand how serious this thing can be, and is in an increasingly younger population. And so healthcare workers and people like me have been accused by some of trying to invoke fear in people about this infection. Well, guilty. We are now trying to invoke fear because I think my feeling about why people are unvaccinated has evolved a fair amount over time. I think to some degree, people it's not convenient. They're in a rural area. They can't have a vaccine that's arm's length away from them. Sometimes it's a mistrust of the government and political issues. But I think increasingly it's just that people aren't afraid enough of this disease process. And I think that, it is just the real truth. I am afraid of this virus, of this Delta variant. And if you're not, respectfully, I would argue that it's just that you don't have enough information about it. Because those of us who are around it and watching it kill increasingly younger people are afraid of it. It is hunting you if you are unvaccinated. This is not political. My coworkers and I do not care what party benefits or not from this problem. We are not seeking votes. This is the science that we are seeing. And none of us has ever put in a plug for a political party. This is an actual killer for far too many. It is not a hoax, as we've said, many patients are telling us now. And I think people need to have a healthy fear of this. Kids do not fear things. That's one of the characteristics of children. Thankfully, we have adults around them who can tell them that hot stoves and playing in traffic are things that should be avoided and are dangerous. And unfortunately, I think we need to have people understand that more and more in the general population about this disease.
Hi, Dr. Threlkeld. This is Mandy Rock with Box 13. I was hoping you could give an update on the number of breakthrough cases you're seeing, and if any guidance has changed for vaccinated people. Say if a vaccinated person is exposed, should they quarantine now since we're seeing an uptick in those types of cases, or is the guidance still that they don't need to quarantine?
Yeah, it's a good question. I've seen a lot of breakthrough cases. Now, let me be careful about saying that, because people will take that and run with it and say, well, then why are we bothering getting vaccinated? And again, I will say, just to reemphasize, the vaccine is still tremendously effective at keeping you from having severe illness or death from this, even being hospitalized. It is great at that. I think probably some of the Israeli data that we have seen coming out is likely fairly accurate. That is, that the current vaccines and everything else with the Delta variant are less effective at keeping you absolutely away from the infection altogether. There will be many people out there who are asymptomatically infected, will have a positive test, won't get ill at all, or will have minor illnesses like a cold, like many of the other coronaviruses out there cause in people. And that's a result directly of the vaccination. So we are seeing breakthroughs. I see them in doctors and nurses. I get calls all the time about it, but they are not ill with the vast exceptions. And so in that sense, they are important. But now, as I think the CDC is going to say, there are increasing data that those people can, in fact, pass it to other people under the right circumstances. People who are vaccinated put out a lot less virus than people who are unvaccinated. So there is that. But the virus is so much more contagious that those things sort of cancel each other out. And so household contacts, for example, of patients with the Delta virus infection are not doing well at avoiding the infection, nearly as well as people were earlier on with the other variants in the pandemic. So I think that in that sense, it's an important difference, obviously. In terms of quarantine, it'll be interesting to see. I do not know what the CDC is going to say about that today. It is still the guidance that folks who are vaccinated don't necessarily have to quarantine. So I'll be interested to see if they actually comment on that situation. I am personally being a lot more careful to tell people that they need to be very, very careful if they are exposed to this virus, even vaccinated. I don't expect them to get ill. I don't expect them to be hospitalized, but increasingly I'm seeing close contacts of people with the illness, even if they're vaccinated, getting at least asymptomatic infection. So we've tried to be very careful in advising people to have a very low threshold to be tested, and certainly if they have any symptoms. I think, unfortunately, along with these other problems, we're seeing a desensitization. Along with less fear of the virus, there's less fear of giving it to others. And we see people all the time going to their jobs with sort of a significant cold, upper respiratory tract illness. Those people need to be tested. And people are increasingly sort of saying, well, I had a little bit of a cold, but I don't think it's COVID. You can't know that, particularly if you're vaccinated. It's why it's a cold rather than a more severe illness. So though there's no official guidance, I'll be interested to see if that changes. And I personally am advising people to be more careful, even if they're vaccinated, because I think we've not been ahead of the curve on how to deal with the Delta virus. We've seen it causing major problems around the world, and now we're just seeing it here. And I think it's hitting us right in the chin when it's hard to be fully prepared for something like this until you experience it. And now that we are experiencing it, it's worse than I had anticipated in terms of its contagion and its spread.
Hi, Dr. Threlkeld. This is Shay with Channel 3. How are you?
I'm good, Shay. How are you?
Thanks for taking some time for us. I know a lot of us had a lot of questions. Kind of a two-pronged question for you, and you touched on it a little bit. But, you know, the way it stands right now, every municipal school district outside of Shelby County schools is going to have masks be optional. What is your opinion on this? And then, you know, is it concerning that there could be adults that are not vaccinated without a mask in a classroom with children who don't have the option right now to be vaccinated? Thank you.
Sure. I mean, the answer to the second part is easy. Yes, it does concern me that anyone is having asymptomatic or symptomatic, mildly symptomatic infection around people who are unvaccinated. Children, obviously, it's been widely discussed and publicized, have less chance of getting severe illness than elderly people. But make no mistake, children get sick from this. Occasionally they die. Interestingly, the childhood mortality rate is rising fairly significantly in some countries. We haven't seen those kinds of numbers yet in the U.S. I think Indonesia is the one that's been put out there with the most data. We don't know what will happen if Delta virus descends completely on our young population. We hope we don't get to see that. I think you're going to see the CDC guidance this afternoon ask for masking in schools K through 12. In everyone. So I think that will be the advice from the CDC. What will be interesting and unfortunate is if there are state laws and regulations that say that you can't mandate that or you can't do it. I think that would be very unfortunate. I hope that people will follow the CDC advice on that. It probably would have come sooner had those data, could we have collated those data and examined them even sooner? So I think that a lot of us who are on the ground taking care of COVID have been saying for some time now, a few weeks anyway, since the question came up, anticipating the school year, that the first part of the school year, we need to respect the Delta variant, which has been the basis of a lot of the questions. We don't know what that does to those studies that were very nice. They were very, they generated a lot of optimism, as they should have. There was little to no transmission in the classroom situation from previous variants that were studied, but they were just that, previous variants. Those studies involved adequate distancing, which cannot always be done in every school. They involved masking of all the kids in the class. And again, they involved non-Delta variants. So how this changes that equation, we do not know yet. So I think several of us, in the people that do what we do in taking care of COVID, have advised that during the first few weeks of the school year, and I've talked to several heads of school about this, we need to be on the conservative side of what we do. We need to err on the side of extra masking, extra distancing, extra testing. All of those contribute to safety in the classroom. Not to mention, of course, vaccinating those kids old enough to receive that protection based on current guidelines. So I think that the CDC recommendations will come out much more in favor of masking for everyone, vaccinated or unvaccinated. Again, sort of to repeat that point about adults, it's very difficult, nigh on to impossible, for teachers to patrol who has been vaccinated and who hasn't been vaccinated in a classroom of 12 to 18, or in classrooms of 12 to 18-year-olds. I think you either mask everyone or you mask no one if it's going to be a policy, because it just would be too hard to keep track of. And I think, again, you're seeing plenty of people in the vaccinated category get the infection. Notice I'm not saying get the disease, because many of them are not sick at all, or if they are, they're very minimally sick. So we have to, I think, turn up the volume on our caution about this for at least the first part of the school year. I'm glad to say that just as the CDC is changing their guidelines, presumably this afternoon, after 3 months of school or 2 months of school, or whatever that time frame might be, we may find no transmission. And if that's the case, then the CDC almost certainly would say, you know, we're doing very well. We can pull back on those sorts of guidelines. And people will say, well, they'll never do that. They've already done it. I mean, the CDC has pulled back significantly, and I do not agree that they did it prematurely. At the time that they did it, it was appropriate. And now the time is appropriate to be a bit more careful, which they're doing now. So they are maneuvering. It is a large ship to turn, and so it's not a surprise that it takes a little while for these sorts of data on the ground to filter up to a national recommendation. But I think that that masks in schools will be the recommendation, and I think it's very reasonable to be pretty aggressive and conservative about that at the beginning of the school year to see where we are.
While we're on the topic of masks, WMC, I just wanted to ask, would you recommend there be the county reinstate mask mandate?
Well, I mentioned that we try to stay away from politics as much as we can, and that gets to be a much more difficult question. Mandates are entirely different from recommendations. I think it's not unreasonable for them to consider that. How well that can be enforced and how many people will comply, I don't know. I think it is certainly reasonable for non-oppressive laws to represent and reflect guidelines of the CDC when appropriate. So I would certainly have no objection to one. How effective and how controversial it would be and how people would respond to it, I think is a much more difficult question. But I think I'm usually best at saying what I do. And what I do is very simple. I have worn a mask a lot more in the last month than I have before that. And then, of course, 9 months ago, we were wearing it everywhere we went, and then we relaxed it. But I've gotten a lot more nervous, afraid even, if you'd like to use the word, of this variant. And so, and I'm around people every day who I could cause very bad outcomes if I go in asymptomatically and spread that virus. So I have to be, along with all the other healthcare workers, particularly who are working with immunocompromised patients, we have to be that much more careful, and so wear masks. I have not worn a mask everywhere I have been inside. I was at dinner the other night, took my mask off and so forth to eat, but I'm going to be more careful about that too right now. This virus we are only learning about even still as it applies to our country, and every passing day we are learning more and more that it is a big problem. And so I am more nervous about it than I was last week, and I was more nervous last week than the week before. So I think that it is difficult to it's difficult to overshoot in our care of this problem right now. Mandates, as I say, it's more of a political question. I think we all should wear masks indoors now. We should be careful, and if the county commission and others decide to codify that in the law, I certainly have no objection to that. And that's something they'll have to consider with all the other all the problems that are entailed in making a law.
Hey there, Doctor. Alex Coleman over Channel 3. How are you today?
Good, Alex. How are you?
Doing well, thank you. Wanted to get your take on mandatory vaccines for healthcare workers. What's the status at Baptist? And do you think this could likely become a trend for other facilities across the country as the Delta variant continues to pack a punch?
Yeah, I mean, that's well put. I think Delta has changed everything. It certainly has reversed course in a lot of ways. I think you're seeing a lot more bodies, groups recommend mandatory vaccinations. Entire countries are actually doing it. It's a very difficult proposition, I think, when you mandate things for anybody, particularly in terms of vaccines. I think the kicker here is whether or not it reaches full FDA approval. You saw the VA go to mask mandates. We've seen St. Jude, vaccine mandates. We've seen St. Jude do it. So obviously, I think we locally, globally, all the healthcare facilities are trying to maintain sensitivity at doing things from a community standard. And that's a little slower to accomplish, I think. But you have to have a little respect for the fact that it is not fully FDA approved. I think that makes it harder. So I think we're focusing, I know, and I think all the hospitals locally right now are focusing on putting everything we can out there to convince people to do it because it's the right thing to do, because it's a very bad decision not to do it. I think the key on that is if and when it is FDA fully approved, I think you will see that change the landscape a bit, and a lot more people will push forward. Businesses of all types, including healthcare facilities, who will push on with mandatory vaccines. A great example of a creative way to do this is Rhodes College, with whom we have worked, and they came up with this independently. I thought it was quite smart. They are not mandating the vaccine for everyone who attends school yet. That probably will change if it is fully FDA approved, which we of course anticipate will happen. They're just allowing for a little more time to look for all of the safety information to come through before they make that. But they are actually charging a bit higher tuition to those who choose not to be vaccinated to account for the substantial cost that goes into the testing to keep everyone safe, principally those people who are unvaccinated, because they're the most at risk for getting ill. So I thought that's a very good, that's a very nice and interesting strategy of how to do that. But I think that interestingly, it's the people who are unvaccinated who are at the highest risk of getting ill here. So I expect, again, the change when you get fully FDA approval, it's not just a larger seal of approval. It is, for example, when you have fully FDA approval, you can do things called off-label use. And that is to say, you can give a vaccine 3 or 4 times if you'd like, if a physician chooses to. Emergency use authorization has several actual advantages. And that is that you sort of have to do what is recommended, and you can't really deviate from that. We've seen, for example, the state of Mississippi recommend that physicians consider giving a 3rd vaccine to people who are immunosuppressed. I think that's a great thing to consider doing that. The problem is, in fact, doing it puts you outside of the emergency use authorization, and that gives you not much standing if something bad happens. It's also harder to test and to see what's going on if people are all over the place in how they are giving these vaccinations. So in that sense, fully FDA approval would allow people to do these off-label uses however they really would like or feel is appropriate. So until then, we're doing it in a way that's easier to study. It's easier to gather data so that we can more appropriately see exactly what is the best thing. That said, I think that 3rd vaccines will likely happen, particularly for those who are immunosuppressed. Not because it helps everyone. We really don't know that. But it does seem to help a few to the extent they can have more antibodies. But I expect to see a lot more mandatory vaccinations once FDA approval occurs. I've seen a lot of people say as a reason for not getting vaccinated, well, I'm waiting for full FDA approval. I'm not so sure that is a totally true objection. I think a lot of the people who say that to me really don't want to get the vaccine anyway. And once it's fully FDA approved, they'll probably think of another reason not to get the vaccine, I'm afraid to say. But I think it will trigger a lot of businesses to go ahead and mandate the vaccination. So I think it will increase the vaccination significantly across the country just because of that.
And at Baptist, is it mandatory or just being encouraged right now?
Strongly encouraged. It's not mandatory except for St. Jude anywhere in the city in terms of hospitals or healthcare facilities. We've certainly put a lot of effort and continue to on a daily basis into encouraging, either in the hallway or through videos or so forth, talking to people, trying to encourage them to get it. And again, that very well may change in the near future. But so far, I think there's been a sensitivity about trying to reach sort of a community standard and certainly to respect people's rights to what they do with their healthcare. But of course, realizing that most hospitals, they mandate flu vaccines, there's no smoking on campus, all these things. The flu vaccine is a fully FDA approved vaccination, and it does put it on a different tier in the capacity to mandate such things.
Thank you.
You bet.
Hi, Dr. Threlkeld, it's Kelly. Just a quick question. Do you happen to have the numbers of pediatric cases across the network? Do you all see it still affecting kids like it has?
Yeah. Kelly, I'm sorry, I'll get that for you. I do not know what the breakdown is of pediatric cases off the top of my head, but I'll certainly happy to get it for you. I do pediatric some practice at our Women's and Children's Hospital. So, but that I don't get consulted on all of them, so I don't necessarily have a great breakdown. We have some very capable people over there, Dr. Snow and company, who run the ICU, and so I certainly don't see all of those, but I'll get those numbers. They're obviously low compared to adults. I mean, the average child does better than the average adult. But again, we're sort of concerned because we don't know how much Delta has filtered down into that population yet. And so those numbers, I think, even nationally are hard to come by. And we talk about breakthrough infections of people, older kids and adults who are vaccinated. The CDC sort of stopped keeping total tabs on asymptomatic or minimally symptomatic breakthrough cases, in part to focus more fully on people who were ill and hospitalized. And that's appropriate, I think. But we may see even a shift backward in that because it gets more interesting because we do need to know those numbers, particularly as we look at the data that come out for the under 12-year-old. I mean, we don't know what those data are with respect to the vaccine trials yet. They're coming, but we obviously, people ask me all the time, well, should I vaccinate my 9-year-old when it's approved? And I'll say, I don't know because I haven't seen the data upon which it is approved or not approved. But clearly it's much lower. But what we don't know is what happens to all of the non-hospitalized patients. We do have better data about that in adults. People who are not hospitalized, they still get the long COVID syndrome. It's not completely proportionate with respect to how severe their acute illness is and how that translates into the long COVID symptoms, loss of taste and smell, shortness of breath, blood pressure issues. There are just a number of things. We now see things for literally IQ can be affected. And some of those data are early and hard to, you don't want to overstate things like that. But we're seeing the very things that people are worried about from the vaccine and have zero evidence to suggest that that's true, they are actually happening as a result of the virus in quite large and sometimes alarming numbers. So it's ironic that people are putting themselves at risk for all of these things that they're worried about in the vaccine in the form of longer COVID. So that's something that we won't know based on hospitalization of kids. We won't know what price they pay, 5 years from now as a result of some leftover effects that have frankly been strikingly more common than we would have necessarily expected at the beginning of the pandemic. Any other questions? I want to make 2 additional points, and they are things that I have just been getting from everything from friends to just questions, social media and the like. There are 2 things. One about therapy for this infection. If you get COVID-19 and you are not significantly ill, short of breath, we recommend that people check their oxygen saturation at home if they have access to such. simply because there are people whose oxygen, particularly in the older age group, can be much lower than they really sense. They're not so short of breath, but when you put an oxygen monitor on them, they are impressively lower. So we do recommend that. But if you are not ill and don't require oxygen, two things you do not want to reach into your extra medicine bag and take. And they are a Z-Pak or other Zithromax or another antibacterial antibiotic, and the other is steroids. And I sometimes see physicians make this mistake too. People will give an antibacterial antibiotic when it has no effect except to increase side effects and C. diff, colitis, and other sorts of byproducts of antibiotics when they're not needed because they don't have any impact on COVID-19 per se. And the other, almost more commonly, is steroid. Because steroids are in fact life-saving and very helpful at preventing the body from attacking our own lungs once the disease has progressed a ways, when you need oxygen and need to be hospitalized, that can be a life-saving therapy. Ironically, early on in the infection, it can be dangerous because it may prevent your body from combating the infection up front and early on, and that may translate into a higher viral load from a less battled virus, which then a higher viral load can translate into later the immune system making the maladaptive and overreaction to attack the lungs. So put more simply, steroids, when you get sick enough to need oxygen or to be in the hospital, can be life-saving. Steroids early on, when you don't need those things or just at home feeling bad, are generally felt to be a bad thing. So if you're given steroids for a COVID case that's only irritating and not threatening, you should very clearly ask, why am I taking the steroid? Now, there may be some exceptions in which steroids might be helpful if someone is asthmatic and really wheezing. That occasionally occurs. But in general, do not take steroid, prednisone, Medrol, dose packs, and the like for early COVID infection. That goes along with the antibacterials. The other question that I've been very concerned about lately is that a lot of people have said to me, people are monitoring me for my antibody level, and I'm waiting for the levels to go down before I get the vaccine. That is particularly applicable to people who've had the natural COVID-19 infection in a previous form, the Wuhan initial wild type variant, the Alpha variant. And that is not a recommended practice. There is essentially very little reason for someone to go out and check antibody levels. I do very little of it, except in the significantly immunosuppressed person that I'm worried did not have a response to the vaccine. Not only is it not recommended, we don't know what those antibodies even mean. There is no way to know whether a 100 level antibody or a 20 level antibody, what that means. Who is more protected? The T cell immunity that we can't measure may be more important in some of those situations, but particularly in those who have been infected with actual COVID-19, the antibody level that you have afterwards is not correlated with protection later. It is a significant mistake to wait and measure antibody over weeks and wait for it to come down. A, it may not come down. And B, the increasing tendency in these new variants is not to respect your antibodies against previous forms of COVID-19. We see this to a degree in Delta, to be sure. When you look at in the test tube, antibodies from people who've had the real infection do not eliminate, do not inactivate COVID-19 Delta variant efficiently, nearly as efficiently as they do even the Alpha variant. Furthermore, other variants who may be at our doorstep, like the Gamma variant, for example, kind of made the name for itself by reinfecting Manaus, Brazil, that had been mentioned it before. They were so heavily infected that people were actually looking at them as a potential example of herd immunity and how that would behave. Well, we found out how it would behave. They were set upon in a large number by the new Gamma variant there in Brazil that infected, again, a large proportion of the population. It did not care whether they had had an earlier form. So waiting for antibodies to a previous variant to go down before you protect yourself from the Delta and maybe subsequent variants, the vaccine, because once you decide, once the Gamma variant, if it gets here, you will have 5 weeks of once you start vaccinating with the RNA vaccine to get protection. We've already seen that one vaccination alone is completely inadequate for the Delta variant. So do not wait for antibody levels. Don't check them. Don't worry about that. Just go ahead if you've had COVID-19 in the past and get vaccinated. It is the clear recommendation right now. Any other questions? Okay, thanks very much, guys. Appreciate it.